I've been in Changi for about 10 years, and then recently I actually left Changi, okay, and yeah, I was hired by Movement Mechanics Physiotherapy, yeah, to be in charge of the center and also to take care of athletes that come by the door. Yeah, but we don't just take care of just athletes. So over here, same as when I was in CGH, I get to see, a wide range of patients. Yeah, from the very young to the very old, from people who are really, really, really sporty and high performance to someone who just is happy, doing things like, the very simple brisk walking, or someone who's never done exercise at all. During my first 2 years as a physiotherapist, I also got the opportunity to be attached to Football Association Singapore. Okay, so I actually got to learn a lot of stuff from Miss Yeo Hui Kun, who was head physio there at that point of time. Okay, so she actually guided me in terms of how to manage a soccer team, techniques that we can actually use to actually treat soccer players, and I found that very, very useful. In my growth as a physiotherapist. Okay, so my first 2 years was a juggle between Changi Hospital, okay, and also going to Jalan Besar Stadium in the evenings to actually take care of the soccer players. I actually have a very like a wide distribution of cases. So, I see cases as young as I think my youngest was about 7 or 8 years old. Okay, to someone who's in their 70s. Okay, so at present, my oldest patient is about 78 years old. Yeah, and basically I see cases, anything ranging from a spinal case, yeah, to someone who's got ankle and foot injuries, knee injuries, shoulder injuries, even the wrist. I have a case that basically was having big toe pain. Yeah, so it's actually quite a varied distribution of cases that I see. Yeah. What I assessed was basically a few components in her knee in terms of whether or not her joints are gliding nicely. Okay, because to be able to bend the knees, all the joints in the knee has to be moving well. Okay, so for treatment wise, I actually did a mobilization technique. Okay, mobilization simply means to actually glide the joints to get the joint play back. Yeah, so okay, what I did was basically to push on a structure called the tibia, okay, to move it backwards. Yeah, so that itself, once it's actually moving well, that will actually give her more range of motion in terms of bending. Everyone who comes through my clinic doors will get entirely the same treatment. Okay, I always aim to understand the individual or the patient as a person. Okay, and I would always assess functions. Okay, so the only difference would probably be in terms of the functional assessment that I do for that patient. Okay, so for example, if you're not an active athlete, okay, you are a housewife and you do a lot more like lifting of your laundry baskets, kind of like taking the clothes or hanging the clothes out through the window. So my functional assessment will be based upon whatever that you do in your daily living. Okay, so for a sports person, I'll probably assess things like your hops, how you actually do single leg stuff, probably more high level, high impact exercises. Yeah, like plyometric hops from boxers. Yeah, so that's probably the only difference that that I'll probably take when I see someone who's not active in sports compared to someone who's very, very active in sports.